The COVID-19 pandemic has positive and negative impacts on different aspects of lifestyle behaviors. Negative lifestyle behaviors are associated with an increased risk of adverse outcomes from COVID-19. While dealing with COVID, we overlook the fact that people's lifestyles were severely disrupted. Many people have become physically inactive and developed irregular eating patterns, which leads to unhealthier lifestyles and aggravation of lifestyle-related diseases. COVID-19 pandemic has also caused significant changes to homes, working life and stress. A multi-sectoral approach promoting healthier diets and increasing physical activity can help in slowing down the diabetic epidemic and heart diseases. Beat Diabetes Myths and Facts will impact and help a large number of people to prevent or control metabolic disorders. Today we have with us experts to share with you advice on leading a healthy life. Dr. Deepak Sadashiv Bhosle, MBBS, MD, PGD in Clinical Endocrinology and Diabetes Consultant Diabetologist, Deogiri Diabetes Care Center, Aurangabad. Dr. Pramod Agarwal, MD, General Medicine, Fellowship in Diabetology, Diabetologist, Agarwal Diabetes Center, Behrampur, and Dr. M. Srikanth, MD, MBBS, FCD, FDRC, Chief Physician, Srikanth's Diabetes Specialty Center, Vijayawada. Thank you so much, doctors, for joining us on this critical conversation today. Dr. Bhosle, I would like to start with you. What additional care or precautions should be taken by the elderly with diabetes who have recovered from COVID-19 successfully to avoid any long-term effects of the disease?
Okay. Ambika, thank you very much. I think actually those patients who have recovered of COVID-19 successfully, they should first of all understand what are the long-term consequences of the COVID-19. So I think the most important consequences are raised blood glucose level, psychological issues, lung fibrosis, breathing difficulties, heart attack, acute kidney injuries, pancreatitis, chronic fatigue, tiredness, and even multiple system inflammatory syndrome. So these are the different problems that can COVID-19 positive patient, once he recovers, he can get. So this is all because of illness itself, or the isolation of the patient, or the stress, or the multiple drugs which are clinician using during the tenure of their illness. So for which my prime suggestion would be control of blood glucose level. Patients should do frequent monitoring of their blood glucose level. They should maintain their fasting and prandial blood glucose level in the tune of 100 to 180 milligram %. HbA1c in the tune of 7% by taking multiple oral antibiotics for the various insulin preparations which they are taking. Along with that, the most important thing is concurrently whatever medications they are taking for morbid illness, they should be continued. Control their blood pressure, control the lipid parameters, take adequate amount of water. And the most important thing is wear mask, the use sanitizer, social distancing, and most important is vaccination. And lastly, it's not that if you have recovered or vaccinated, chances of reinfection are still there. So my suggestion would be, by and large, all these parameters, if they are adequately controlled, you can actually prevent future infection and future long-term consequences of COVID-19.
Dr. Agarwal, it has been observed that healthy people with no previous history of diabetes are also developing high blood glucose levels after recovering from COVID-19 infection. Is it temporary? Do they need to take any sort of medicine or insulin?
Thank you very much for inviting me to your program. I think your question is having three parts. Number one is whether people are developing diabetes after COVID.
Yes.
Second is whether it is temporary, and third is whether they require insulin. So let me tell you that during COVID, it's an inflammatory disease, and some people are undiagnosed with diabetes, and when they go to the hospital, they are detected for the first time. Number two, they may be pre-diabetic and develop florid diabetes during the course of the COVID disease in the hospital. Third is because of stress and because of use of certain drugs like steroids during the management of COVID, they may develop diabetes. And diabetes may not be new to them. They might be having, and it has become manifested during COVID times, number one. Number two, whether it's temporary. Diabetes management actually rests on three parts: a good knowledge of the disease, balanced diet, and regular exercise, and if required, medicines or insulin. So if they are having early diabetes, they are not having very high average blood sugar, HbA1c, then with a balanced diet and regular exercise, if they are able to maintain their blood sugars, they can stop their medicines.
Okay.
And regarding insulin, during treatment of COVID, insulin is the drug which is given in the hospital for a better management of diabetes and to prevent diabetic ketoacidosis. So in long run, they can stop taking insulin and convert it to tablets under the guidance of a physician and a diabetologist.
So, I mean, it's important actually, like the points what you've said, that's important to keep in mind that what level of diabetes, the severity as well. Dr. Srikanth, looking at the increasing number of people with diabetes, should blood glucose checks be made mandatory? Should blood glucose be tested in all patients who are hospitalized? And should it be considered as a fifth vital sign that needs monitoring?
The measurement of vital signs is an important part of clinical workup. Body temperature, pulse rate, respiration rate, and blood pressure are four main vital signs routinely monitored by doctors. Presently, measurement of blood glucose is a factor for concern, mostly when treating individuals with diabetes. Blood glucose level, even when in high normal range or in slightly high range, is an important determinant of morbidity and mortality, especially in hospitalized patients. Blood glucose variability and hypoglycemia in critically ill individuals without diabetes causes excess in-hospital complications and mortality. Hence, blood glucose be measured in all hospitalized patients and should be considered as fifth vital sign. Further, variability of blood glucose must be taken in consideration of treatment protocol in an effort to decrease mortality in individuals without diabetes.
Dr. Bhosle, there are some misconceptions regarding the levels of blood sugars that can diagnose diabetes. Which parameters need to be checked before confirming that a person has diabetes?
So, Ambika, it's a very good question. As there are a lot of dilemmas regarding the diagnosis of diabetes, but American Diabetes Association has given a very clear-cut guideline about the diagnosis of diabetes in non-pregnant adult based upon the fasting blood glucose level, HbA1c value, and the values of oral glucose tolerance test. Now, depending upon the fasting blood glucose level, any blood glucose level more than 126 can be categorized as a diabetic range. Any range between 100 to 125 milligram is a pre-diabetic range where the patient is roaming for few years. Later on, it is getting converted into overt diabetes. And based upon the oral glucose tolerance test, any value less than 140 is normal, 140 to 199 is pre-diabetes, and anything more than 200 milligram per deciliter is a frank diabetes. And based upon the another tool that all of us are using commonly in clinical practice is HbA1c. So any A1c value less than 5.7 is normal, and between 5.7 to 6.4 is that gray zone of pre-diabetes, and anything more than 6.5 is a frank diabetes. This is for the non-pregnant adults. But for pregnancy, the cutoffs are different. Whatever cutoffs they are given by the American Diabetes Association and American College of Obstetrics and Gynecology, fasting blood glucose level more than 92, 1 hour glucose level more than 180, and 2 hour more than 153 milligram can be categorized as a special form of a diabetes. We call it as a gestational diabetes. But in the recent pandemic of COVID-19, we have seen actually a lot of haywire in the blood glucose level, which has been attributed to the lot of stress created in a patient because of isolation, then the different drugs which are used, especially the steroids I'm talking. So during COVID pandemic, the much important needed thing is the control of hyperglycemia. So any blood glucose level which is more than 140 milligram per deciliter, which is seen in COVID-19 patient, irrespective of HbA1c value, need to be treated by using insulin preparation in admitted patient.
Okay, so thank you for explaining, the different values. We'll come and discuss that again. Dr. Agarwal, people who have been recently diagnosed with diabetes or pre-diabetes hope to stop medications in future by making suitable lifestyle changes. Is diabetes reversible, or do people have to take medications lifelong? Because there is a lot of confusion on this.
There's a very common question. Whenever we see new patients, that's the first thing they ask. Doctor, when should I stop taking medicine, or when can I stop taking medicines? But diabetes is a disease of complications. There may be acute complications if diabetes is uncontrolled, and there may be chronic complications like blindness, cardiac stroke, brain stroke, then kidney failure, and amputation of legs. So the first and foremost aim should be to control the blood sugars. So we need not worry about stopping the medicine, but everyone is really worried when to stop the medicines. So if there is early diabetes, or if the HbA1c is not very high, if the blood sugars are not very high, then with the diet modifications, with regular exercise, having a good knowledge of diabetes and medicines, first you need to bring down the blood sugars to normal. Once the blood sugars are normal, then the physician decides whether we should reduce the doses or not. So according to the physician's discretion, the medicines will be reduced. If not, they will be maintained like that, the blood sugar maintained. But a patient who's having very high blood sugars like 300, 400 with a A1C of more than 9, then they cannot stop, they cannot think of stopping medicines because they will land into complications. So from day one, all patients need to control their blood sugars, and that should be the aim. The aim should not be to stop medicines, when to stop medicines. And regarding reversibility of diabetes, yes, some claim that diabetes is reversible. Actually, diabetes is not reversible. It is, it can be postponed, it can be delayed, it can be controlled, it can be prevented, but it is not reversible. To preventable diabetes or diabetes can be delayed, people say that it is reversible. Actually, it is not reversible.
So I think that's a very important point.
Diabetes, it would be wrong.
Okay, sure. Okay, thank you. Because diabetes you said is not reversible, but what you really said is important here is that not to stop medication at any point, not to like self-medicate or say that, oh, now my sugar. So one needs to consult the physician. Dr. Srikanth, there are various medications available for the treatment of diabetes. Some people need oral medications and some people may even need insulin injections. Can a person on oral medication take insulin, and can a person on insulin after long-term control of blood sugar switch to oral medications?
People with type 1 diabetes needs insulin treatment lifelong, as type 1 diabetes is insulin dependent and there is insulin deficiency in the body. Type 2 diabetes is mainly because of insulin resistance. Insulin resistance is when cells in your muscles, body fat and liver starts resisting or ignoring the signal that the hormone insulin is trying to send out, which is to grab glucose out of the bloodstream and put it into your cells. With healthy lifestyle changes, you can reduce insulin resistance. Hence, you can manage type 2 diabetes at early stages with lifestyle modification. Oral diabetes medicines, that is taken by mouth, help control blood sugar in people whose bodies still produce some sort of insulin, such as some people with type 2 diabetes. Some people with type 2 diabetes can benefit from using both medicines, oral and as well as insulin injections. With increasing age, pancreas can get more damaged and there is very less insulin secretion. In this case, people with type 2 diabetes may need insulin therapy. Pills aren't effective in people with type 2 diabetes when the pancreas has stopped making insulin.
On that note, we're going to be taking a short break. We'll be back on Beat Diabetes, Myths and Facts. Welcome back. You're watching Beat Diabetes, Myths versus Facts. Dr. Bhosle, healthy eating habits are crucial when you have diabetes because what you eat affects your blood sugar. But some people with diabetes who are on insulin therapy believe that being on insulin means you don't have to make any lifestyle changes. What is your advice for such people?
It's absolutely myth. Actually, if you are on insulin, you need to follow the lifestyle modification. So this is the first line that I will tell. The most important thing is the component of lifestyle is actually diet, exercise, and the different kinds of habits which patients they are having. Actually, repeatedly we are reinforcing them to quit those habits. So before that, actually one should understand the natural course of the disease. Now, once if you start developing diabetes, so that time actually 50 to 60% of your insulin producing cells they are lost, and remaining they are lost at the rate of 4%. And if you see the diabetes treatment, it is a step-up approach where we are starting with the lifestyle modification, then 1 drug, 2 drug, 3 drug, maybe 4 drug, and then we are putting the patient on insulin therapy. But the most important thing that one should understand here is type 1 diabetes and gestational diabetes. These are the two types of diabetes which need to be put on insulin for their span. Basically, type 1 diabetic for whole life and gestational diabetes for the duration or tenure of pregnancy. And ideally, if you ask me actually about the lifestyle modification, it need to be separately generated as a prescription. At our clinic, we are regularly giving the lifestyle modification prescription, which is given by our diabetes educator. So lifestyle modification and insulin both are equally important at any stage of a disease. So be careful when you are on insulin. It doesn't mean that you can eat anything. And remember, every food it has its own defined glycemic index or it's a sugar content, and accordingly it can change your blood glucose level. No matter what you are taking, you need to continue with the lifestyle modification once if you are diagnosed as a diabetes till the end of your life.
That's why they call diabetes. It's all about managing the disease really well. Dr. Agarwal, the adoption and maintenance of physical activity are critical for blood glucose management and overall health in individuals with diabetes. But people on insulin therapy are confused about time and amount of exercise they should do. Please guide them about the same.
Definitely, exercise is an integral part of the management of diabetes, along with the balanced diet and good knowledge of the disease and medicines or insulin as advised by the physician, or medicine plus insulin. But those patients who are on insulin are at a greater risk of developing hypoglycemia or low blood sugars. When the patient will have features of sweating and then confusion and head reeling, and then suddenly they may collapse. So to prevent all these things, first of all, you need to take permission of your physician as to can we do exercise and how much exercise we can do and which type of exercise we can do. Usually patients on insulin are more chronic patient and patients with complications who are put on insulin, or those who really require insulin, that is insulin dependent diabetes, they really require insulin for survival. So these patients, if they have complications, they should discuss with the physician, because exercises are of different types. One is non-weight bearing exercises like swimming and cycling, and then normal walking. This can be done by patients who are taking on insulin, but they should not go into hypoglycemia. Their blood sugars will be well maintained. Only then they should go for exercise. And those who are doing weight bearing exercises like jogging and skipping and brisk walking, they can continue that. But those who are on insulin, they should be very careful and prevent hypoglycemia. And above all, they should carry around 15 grams of glucose, or there are nowadays glucose tablets are also available in the market. They should carry them with them during their walking and during their exercise, so that if at all they have features of hypoglycemia, they can take them. This was regarding low blood sugar, but those who are having very high blood sugar also, they should not go for exercise without taking the permission of the physician, because complications may increase, they may exaggerate, like retinopathy or nephropathy, that may increase in a diabetic patient who are on insulin. So they should be very careful before doing exercise.
Sure, and awareness needs to be there on what kind of exercise works. So the physician is important here. Dr. Srikanth, there is a popular phrase, prevention is better than cure. What can one do to prevent the complications of diabetes?
How various types of diabetes are treated depends on various factors, including type of diabetes, age of onset, blood glucose control at the time of diagnosis, and behavioral and lifestyle factors. The commonality among them is that adequate blood glucose control can prevent or delay complications of diabetes. Blood glucose control requires diligence with self-management. It is possible to live a healthy life with diabetes. Controlling blood sugars is the #1 objective of diabetes management. If you are not sure what your blood sugar targets are, it's important to have a discussion with your diabetes care team. When you have diabetes, healthy eating is an important part of treatment. It is important to learn how to integrate healthy and safe eating patterns that are sustainable, ensure that you maintain the pleasure of eating, and help you reach your health goals. There is no one-size-fits-all eating plan, but include a lot of raws in your diet and avoid sweet and junk food. Eat fiber-rich food. Physical activity helps to lower blood sugar by making cells more sensitive to insulin and reducing insulin resistance. Daily, 40 to 45 minutes of exercise is essential. Lose weight if needed. Even 5% weight reduction can do wonders. It will improve insulin secretion and improve insulin sensitivity. Take medications as prescribed. Medication management in combination with diet and exercise is often an essential part of reaching therapeutic goals.
Thank you so much, doctors, for joining us today. So it's important that we learn how to manage diabetes well. Of course, having knowledge, awareness on what to do, whether it's exercising, eating the right kinds of food and lifestyle changes is the key here. Thank you all so much for watching.